Welcome everyone. My name is Laura Robbins and I am a women's health physical therapist at Marathon Physical Therapy, and I'm here today to orient you to the bony pelvis as well as the pelvic floor muscles. So, first and foremost, where is the pelvis itself located in our body? So, the pelvis itself sits centrally in our body. The pubic bone sits to the front of the pelvis, right through here, and the hip pointers sit anteriorly as well. The spine comes down through the back and attaches into the bony sacrum, which is an inverted triangle at the base of our spine. That sacrum attaches laterally to the ilium, creating a bowl for the pelvis. The primary job of the bony pelvis itself is load transfer. So load transfer is the effect of ground reaction forces through our legs as well as gravity pulling down our spine. And how does the pelvis fit into that? The pelvis itself actually transmits that load, and if everything is working appropriately within the pelvis, is able to accurately transmit that load throughout these bony joints without having dysfunction or pain. So, to go over what the pelvic floor is, the pelvic floor as a group is a group of muscles that sits and closes off the pelvic opening or the pelvic outlet through here. The pelvic floor has 4 functions in our bodies. The first function of the pelvic floor is to support the pelvic organs. The pelvic organs are your bladder anteriorly, your uterus that comes up right above the bladder itself and attaches into the vagina, and then lastly, posteriorly, is the rectum attaching to the large intestine, sigmoid colon, exits through the back of the pelvic floor. So the pelvic floor supports those 3 organs and keeps them elevated against gravity. Its second function in our body is to maintain continence. How it does that is by maintaining a general tightness throughout our urethral sphincter as well as our 2 anal sphincters. In that sense, the pelvic floor closes off these openings to allow the urethra, bladder, as well as the rectum and the colon to fill and to only relax when our bodies are ready to do so. The third function of the pelvic floor is sexual. The pelvic floor muscles actually attach into the clitoris anteriorly above the pubic bone, and they help stimulate this during arousal. Additionally, the deeper pelvic floor muscles squeeze and relax to help with heightened sexual function as well as reach the point of orgasm. And then lastly, if we go back to the bony pelvis, the pelvic floor muscles create a good cycle of tension in order to disperse that load transfer through the bony pelvis. The pelvic floor itself works very closely with varying hip muscles as well as core stabilizers to allow that transfer of load through the legs as well as through the spine itself. So, in a nutshell, the pelvis, the bony pelvis itself, is almost like Grand Central Station in terms of transmitting load. And the pelvic floor helps with many functions in our body, being a multi-system muscle affecting your urinary, your reproductive, as well as your colorectal systems. And in order to maintain proper function of all those systems, it works directly with the bony pelvis and transmits that load properly. So that is your brief orientation to the pelvis and the pelvic floor muscles.